All right, so otitis media is an inflammation of the middle ear. So we also can have otitis externa, which is an inflammation of the external part of the ear. That's sometimes called swimmer's ear because one of the more common ways to get it is through irritation or inflammation that's caused by getting water in the ear. Otitis media is directly behind the eardrum, and then otitis interna is an inner ear infection. So we're talking about otitis media, which is the most common, and that's inflammation of the middle ear. That can be classified two different ways. There is acute otitis media, which is inflammation of the middle ear with rapid onset of the signs of acute infection. So this is, they were okay, now their ear hurts, and if you look at it with an otoscope, it may be red, bulging. Otitis media with effusion is more chronic inflammation and fluid in the middle ear without symptoms of an acute infection. And we see that a lot with allergy kids. Okay. So what happens, fluid accumulates in the middle ear behind the eardrum, and it becomes colonized with bacteria. This is usually bacterial. It's usually secondary to a viral upper respiratory infection. So the upper respiratory infection, all the edema in the upper respiratory tract doesn't allow for adequate drainage of the eustachian tubes. So fluid sits there and then it gets infected with some kind of bacteria. They don't really know the etiology of non-infectious otitis media, but allergies seem to be connected. The risk factors, if they're under 2, their eustachian tubes are shorter and straighter, and so they're at greater risk. Boys tend to get more ear infections than girls. Family history that tends to run in families. A large household, there's a lot of people in the house. Passive smoking, exposure to other children. Socioeconomic status, and I don't know what the connection is. I'm not sure what that connection is, but it's there. Bottle feeding is a risk factor. Breast milk is protective, but also the action of using a bottle, the way that the baby has to suck the bottle, can push more fluid into eustachian tubes. Bottle propping, because that can allow whatever's in that bottle to pool, and pacifier use. So all of those things can increase the risk of ear infections. So what does this look like? Well, acute otitis media usually follows an upper respiratory infection. They've had a cold. Now they have ear pain, fever. They may or may not have purulent discharge from the eardrum. The eardrum can actually rupture, which tends to decrease the pain because the pressure's gone away, but then you'll see blood and pus draining. Chronic otitis media, they may complain of fullness, tinnitus in their ear, tinnitus and vertigo. They may actually be mistaken for having a developmental delay because it causes hearing loss, but it's kind of a gradual hearing loss, so they don't realize what they're missing. Medical management. For diagnosis, the provider may use an otoscope but they may do what's called a pneumatic otoscope exam. They may see the tympanic membrane red and bulging, full, or it may look opaque or immobile. And if they puff a little air in with the otoscope, they can see if the eardrum moves with that or not. For otitis media with effusion, the tympanic membrane is going to be immobile and look orange or discolored. It also may be diagnosed by symptoms. Now, treatment. They used to give everybody antibiotics for every ear infection, but that contributed to antibiotic overuse, and kids developed resistant bugs. And a lot of times ear infections will clear on their own. So if the child doesn't meet the criteria for antibiotics, then they get watchful waiting, and they keep going back and looking to see if it's improving. Penicillin is the first choice antibiotic, but resistance is common, and so sometimes they have to keep changing antibiotics. So here are the guidelines for antibiotic therapy. If they have severe signs or symptoms, so if they're crying in pain, their eardrum looks like it's about to bust, they're probably going to get some antibiotics. If they're younger than 6 months, they get antibiotics. And if the signs of acute otitis media have persisted for 72 hours. If they're having severe pain, a myringotomy can actually be done in the office. They just make a little incision in the eardrum to allow that fluid to drain to decrease the pressure. Otitis media for effusion, these kids need to be monitored for hearing loss. If it's persistent for greater than 3 months, they may do a course of antibiotics. If it lasts greater than 3 months, antibiotics. If it lasts 4 to 6 months, then they consider doing tubes to drain that fluid. Nursing care, prevention is our first priority. Pneumococcal and Hib vaccines have actually decreased the incidence of ear infections because both those bacteria were responsible for a lot of them. And we want to teach families to reduce those risk factors, avoiding smoke exposure, harm reduction for smoking, breastfeeding, avoid bottle propping, avoid allergens. We want to promote comfort. So teach families how to give analgesics properly. Warmth can also increase comfort. And sometimes the air, especially if the air is cold, can cause increased pain. So you'll see people put cotton in their ears because that decreases the pain. We want to promote drainage. A cotton wick or gauze can be used to absorb the drainage, but it needs to be loose enough to allow that drainage to come out. We need to teach about when antibiotics are not recommended and why, and when they get antibiotics, teach them complete the whole course, don't save them for the next ear infection. If they've had a tympanostomy, tympanostomy is when they go in and incise the eardrum and put a little tube. It looks like a grommet. Those tympanostomy tubes look like a little grommet. What do they need to do while they have those tubes in place? They need to avoid swimming in water that's not chlorinated, avoid getting bath or shampoo water in their ear, and to expect that tube to fall out after a few weeks. All right, we'll talk about sleep disordered breathing in the next section.